Thank you. Good afternoon. Thank you for the extraordinary honor of serving as your chairman. I pledge my very best in supporting our AHA vision for advancing the health of all individuals and communities, and I appreciate the remarkable privilege of working side by side with my fellow board members, the terrific, hardworking, and knowledgeable AHA staff, and colleagues across the country, especially at a time when our nation's progress in achieving access to health care for our fellow Americans is being challenged in the Supreme Court. I commit my best efforts to you for working in shared purpose, transcending our differences, and honoring our collective mission of serving America's healthcare needs. I'd like to offer thanks to our past chair, Jim Hinton, for his dedicated service. Jim, you have done all of these things so very well. As chairman and in leading the Committee on Research before that, you helped facilitate frank discussions on how hospitals can begin to redefine themselves to meet the accelerating demands of a changing nation. And you did this with characteristic insight, optimism, and humor. Thank you. I share Jim's optimism that our best opportunities for serving our country's health needs lay ahead. I believe that the very pressures that compel change for our field also offer the opportunity to redefine both how we provide care and how we support health. One of my favorite mentors at the Medical College of Virginia, Dr. Richard Wenzel, was fond of reminding us to make good use of our time by quoting a passage from Rudyard Kipling's poem If, which challenges us to fill the unforgiving minute with 60 seconds worth of distance run. Your AHA board is committed to filling each unforgiving minute to advance the health of individuals and communities to the very best of our collective capability. To realize this vision requires the support of everyone in this room, from state and allied health association executives and their boards to individual, institutional, and associate AHA members. It takes a community to serve the community. Growing up in Baltimore in the late 60s and early 70s, I watched as my father worked for mental health care that served the community not only in the hospital, but actually through setting up mental health services in the community. And my mother worked to bring art education from inside the museum walls out into the community. Clearly, their inspiring lesson inspired me. So please join with me in recognizing them here today. My brother Steve is also here today, and some of you know him. He's long worked with the Illinois Hospital Association and other hospital associations around the country as a champion for sustainable reimbursement models. And my wife, Donna, a pediatric emergency physician, and my daughter, Sarah, well, you are the sources of love, inspiration, support, and grounding for me. And I couldn't do this without you. So thank you. And thanks to all of my family members who are here today. Finally, I'd like to recognize my terrific colleagues from HCA as well as VA and VCU, to whom, like my family, I owe so very much for teaching me, supporting me, and working in shared purpose for better health and better care. And the truth is that our shared mission requires the continuing support of everyone in this room and all of our colleagues. In practical terms, our nation is facing an existential debate about the Affordable Care Act's promise of providing the necessary access to health care that all Americans deserve. As we await the Supreme Court's ruling, we need to realize that an adverse decision would displace approximately 9 million Americans from their newly gained health care insurance, resulting in raising premiums by over 50% for those sicker patients who are compelled to remain. While this is a judicial decision, it will not be made absent context, and our job is to continue to give voice to that context and to create contingency plans ready for rapid implementation if necessary. History will record that AHA leadership helped increase access to care through the new health insurance marketplace and through Medicaid expansion. And the tenure of AHA President and CEO Rich Umdenstock will forever be associated with the greatest expansion in health insurance coverage since Medicare and Medicaid were enacted as part of Lyndon Johnson's promise for the Great Society. I know that I speak for the entire board and all AHA members in appreciation rich of your thoughtful and visionary leadership, your ability to bring field insight to the most difficult policy challenges and to guide AHA's members through some of the most significant, demanding, and exciting times in healthcare. Many thanks to both you and to Barb for your leadership, your wise counsel, and for your friendship. Rich, I also know that you would be the very first person to tell us that with more than 40 million people in the United States still uninsured, we remain too far from realizing the full promise of our mission. And we all know there's a lot of work yet to be done. That all states have not yet adopted Medicaid expansion reminds us that the tide of progress has yet to lift all boats. It means that some of our most vulnerable fellow citizens are not yet provided with the equity of opportunity that others experience. And as chair, I am committed to working with all of you, to working creatively with AHA and state association leadership and other members to find solutions that improve both health and care. Your AHA board and staff know that we are entrusted to find consensus and common voice in redefining the H that represents America's hospitals and health systems. We also know that we are entrusted not just to express our concerns to legislators and policymakers about what worries us and doesn't work. We are obligated to bring forward solutions that we know will work. We know that among our membership, there exists a deep reserve of intellectual capital with solutions to vexing problems that are grounded in science, not ideology. These solutions can transcend petty partisanship and support the willing in constructive statesmanship. That is our job. It's difficult to think of our AHA mission, our platform, our commitment to sustainability and to sustainable business models for our member institutions without also thinking about the triple aim. The triple aim represents the triad of enduring goals that encapsulate our aspirations for better health, better care, and better value. While we may experience these times as turbulent, I am personally optimistic. I'm optimistic that this turbulence provides us with an opportunity to learn from each other and to innovate in health and care and value. When I was a young doctor in the Veterans Health Administration, I had a favorite patient with terrible emphysema. And every summer, his condition deteriorated and he was in and out of the hospital constantly. Unfortunately, and more than once, he ended up on a ventilator in the intensive care unit. And while it was technically true that great care saved his life, it's equally true that far too frequent hospitalizations impaired his quality of life. The single most powerful prescription that I ever wrote was for this patient. It helped him stay out of the hospital all summer long. You've probably guessed, the prescription was for a window air conditioner. There's an important lesson here. We need to build a system that not only provides great care, but greatly fosters health and well-being. I believe that the turbulence we face today compels us to redefine the hospital of yesterday for the healthcare of tomorrow. And I believe that this turbulence will help us develop tools to write fewer prescriptions for care and more prescriptions for health. We have plenty of opportunities for improving care too. In HCA, we're learning how to be a learning health system. That means that we commit to using data that are a byproduct of the care that we provide to inform and improve the care that we provide in the future. Let me give you an example. Partnering with Harvard, the CDC, the Agency for Healthcare Research and Quality, and with others, we compared 3 potential best practices to find the true best practice for avoiding MRSA and other potentially life-threatening bloodstream infections. So the 3 approaches were: 1, to screen all patients for MRSA on admission to the intensive care unit, and, if positive, place them in isolation. Approach 2 involves screening and isolation, but also providing an antiseptic sponge bath and nasal antibiotics to reduce bacteria. Finally, approach 3 was not to screen at all, but to reduce bacteria for all patients on admission to intensive care. 43 HCA-affiliated hospitals were randomized to one of the 3 approaches. Not over the course of 64 years in a single hospital, but in 43 hospitals in just 18 months, you can do the math, 75,000 patients helped us prove that the true best practice was approach 3, reducing bacteria in all patients. The sponge bath and the nose drops reduced not only MRSA by 37%, but it reduced all bloodstream infections by 44%, setting a new standard for care and, most importantly, saving lives. Not only does this approach cut infections by almost half, as we've published in the New England Journal of Medicine, but for every 1,000 patients for whom bacteria were reduced, it saves about $170,000. This demonstrates another important point. Better care and safer care is always better value. I'm so proud of the American Hospital Association's efforts to scale improvement throughout the hospital engagement network. Scaling best practices for infection prevention, preventing elective preterm delivery, and improving surgical safety to hospitals across the country likely saved 15,000 lives and the better part of $4 billion. America's hospitals and health systems have been hard at work on producing better value through better care. As we think of redefining hospitals and health systems for the future, our minds are drawn not just to care, but also to health. It is impossible to imagine that we can truly bend the curve of cost sustainability without also improving the health of the community. An important lesson that I learned when I had the privilege of leading the VA health system over a decade ago was that access to care was a prerequisite for health. As VA hospitals embraced community outreach and as veterans gained improved access to better preventive services, veterans' ability to function, their health indicators, and even their longevity went up. And get this, the total cost of care per veteran, it went down. We've published those data. Let me give you an example. In 1996, veterans were almost invariably diagnosed, and tragically diagnosed, with late-stage colon cancer. By 2004, veterans were almost always diagnosed with early-stage colon cancer because of better access to screening. With access, the care was safer, more effective, and certainly more compassionate, and it was more efficient. The intersection of better health, better care, and better value also represents the point of convergence for the American Hospital Association's advocacy and field leadership agendas. So it is probably no surprise that the platform I embraced for my time as chair, meant to reflect our collective responsibility to our mission and our members, is a rededication to the triple aim. It's this simple. We can't have a sustainable health system without constantly improving care and health. And we can't get to health without engaging the community, and we can never get to health without access. Therefore, we can never let our momentum in increasing access through the health insurance marketplace and through Medicaid expansion dissipate. This time, these meetings symbolize not what differentiates us, it represents what binds us together, our shared mission of both health and care, and our shared commitment to AHA's vision for a society of healthy communities where all individuals reach their highest potential for health. So this afternoon, as I accept the responsibility for chairing the American Hospital Association, I thank you for your support and for your continuing commitment to the important work that we will accomplish together in redefining the hospital of today into the healthcare of tomorrow, in support of the extraordinary roles that hospitals play in communities across our nation, and in bringing forward our clearest and strongest collective advocacy voice, and in using the moral authority of our mission to advance both health and care. I look forward to working with you to fill that unforgiving minute with 60 seconds worth of distance run. Thank you.